Welcome to Let's Clear the Air, a podcast sponsored by the Allergy, Asthma, and Sinus Center, dedicated to educating listeners about allergies, asthma, and immunology.
Welcome to this episode of Let's Clear the Air, all things allergy, asthma, and immunology. This is your host, Marcella Feathers, and I'm here again with Dr. Erin Rohman. Hello, Dr. Rohman.
Hi, thanks for having me again.
Yay, I'm always excited.
It's going to be a great time. Great discussion I
yes.
think we're going to have today.
Yep, we're going to dive into something that I've been curious about myself. I have some family members who just have infants, toddlers, the little ones, and they get runny noses. They go to daycare. They catch all of the different things that are going through daycare. And just from working with the Allergy, Asthma, and Sinus Center, I'm curious, how do you know at what point and what age even is it safe to, or would you want to bring your child to an allergist?
Yeah, that's a great question, Marcella. So I see babies all the way through adults, of course. And so that baby toddler time, infant and toddlerhood, is when parents feel unsure about whether allergy testing is necessary, whether a referral to an allergist would be beneficial. So let's talk about some of those things that they might be experiencing with their child that would warrant a referral to the allergist. When we think about infants, we think about food allergies. That tends to be a big concern with the infants, and they may be experiencing things like frequent spit up, vomiting, failure to thrive, not growing well, chronic diarrhea. Those are things that sort of trigger in a parent's mind. Maybe it's something they're eating. Maybe it's the milk. How do we know what could be causing this? So I think if you've gone to your pediatrician or your primary care provider and the symptoms are persisting despite measures that you're taking already at the direction of your provider, then maybe it's time to seek an allergy specialist's opinion. Now, just because you go see an allergist doesn't mean that allergy testing has to take place. It's just sort of starts with a conversation, a consultation to see, oh, yes, actually, it does seem that certain foods trigger these symptoms. Maybe an allergy skin test would be beneficial. As far as what age do we start those? I mean, I've had to skin test a baby at age 6 weeks before due to a concern about a milk allergy. So there's really no too young to do an allergy test. It's really between the parent and that provider, that allergist, deciding when is the right time, how severe are the symptoms, and how important is it that we figure out exactly what's causing it at this time. Other things in infants and toddlers is eczema, so skin conditions, and often parents tend to think that it's a food trigger when often what I find, Marcella, is that it's an environmental trigger. So it's important to differentiate for parents and children that they may be thinking one direction, but actually we're going to end up taking that a totally different direction. So allergy testing can be helpful in determining what path we need to take ultimately to improve that child's quality of life, to get them better, whether those are GI symptoms, whether those are skin symptoms. And then I want to touch on as well the runny nose that you talk about, right? It's so difficult when you have a child, especially maybe one in daycare, who just seems to catch everything. They're sick all the time. You never look at them when they don't seem to have a runny nose, right? You're just going through the Kleenexes constantly. And so it can really be beneficial for a parent who's just sick and tired of being in and out of that primary care provider's office constantly, either being told, oh, it's just allergies, give them some allergy medicine, or oh, it's just another respiratory virus. So helping parents differentiate can alleviate some of that frustration that they feel with the constant symptoms and not knowing really what the trigger is. So that's what I find satisfying about it as we develop these relationships with infants and toddlers and then on to childhood and the teenager years. It's never too young for a visit to the allergist. You and your allergist will decide if a skin test is important. And then again, helping them figure out what is the cause and what's the direction of treatment that we need to take. That's really the fun part about the allergy testing.
So I know that you would want to, as a parent, not to to try to limit their diet too much as far as like, especially if it's a milk allergy. I mean, there aren't a whole lot of other alternatives, breast milk or, formulas and such. You want to know that those are safe.
So, Marcella, I think parents can feel frustrated because when you're introducing foods to a toddler, you don't know what direction to go if they're having reactions. If it seems that they're having excessive spit up when they eat certain foods, or their skin flares up, their eczema flares up after certain foods, but you're not really sure, then you sort of become afraid to introduce new foods, right? And so you really limit the diet for a child at a time when they should be getting to explore all kinds of new things.
Yeah.
And parents are really anxious and fearful at times because no parent wants to give something to their child that could be harmful. So that allergy skin testing can really help clear the air, so to speak, on what it's safe to give them and what needs to be avoided. The other thing that's important to know is if you eliminate a food from the diet that's not necessary to eliminate, and then you have an accidental exposure years down the road, you actually can sort of set that child up for having a more severe anaphylactic reaction down the road. So all the studies have come out showing that early introduction is best. But when a parent is seeing certain symptoms or reactions on the skin after introducing foods, they become leery about introducing those new foods. And so getting a clear picture of whether or not the child has food allergies and if any foods need to be avoided or whether it's a green light on certain foods can just really open up the world for parents and their children in that fun and important time of new food exposures.
Yeah. And talking about going back to allergies, if a child has environmental allergies and they're not treated, there is the chance too that they can develop into asthma, correct?
Yes, that's exactly right. And so as they approach toddlerhood and that younger childhood time, that's really a great time for that environmental allergy testing. I have lots of parents who are concerned about pets in the home. And often what I find, Marcella, is the allergy skin testing proves it has nothing to do with the pet. And so, parents who had been thinking about rehoming a pet or making decisions within the family about pets can really do that with a better mindset of exactly what those allergies are. I often use the example, if a patient is allergic as in childhood to pollen and dust and dog and mold, well, removing the dog from the home really solves such a small portion of the picture that let's work around those things together to keep the family intact in the family pet is part of that.
Yes.
So that's where I like to use the skin testing in childhood is that those toddler and early childhood years. And again, as well, there are treatment options such as allergy immunotherapy, also known as the allergy shots, that can actually help prevent asthma. So when parents hear that, all of a sudden they are very interested in, again, figuring out what those allergies might be, getting on the right treatment plan that can not only improve symptoms and quality of life now, but possibly prevent future problems down the road.
Nice. Now, what's your experience been with skin testing and the allergy shots immunotherapy for toddlers or infants? I mean, are they pretty, as my understanding is, the skin test itself is just a prick, a scratch on the skin. And then if there is any reaction, we tend to soothe that very quickly with our Sarna or what have you.
That's right. That's a good point to bring up. So typically with infants, we have that skin test on before they really realize what's going on. If something is itchy, it can make the child a little irritable, but there's not that fear yet, right, in the infants and often in the toddlers as well. We have very wonderful, experienced nurses who can often have a skin test on in less than a minute. And so it's a very quick process. It's pretty not a lot of pain involved, maybe just some mild discomfort. And those early years where parents are often nervous, they come out the most pleased because their child has had it and really not even realized anything was going on.
They were probably more nervous than the child was.
That's right. That's right. And then at the school age level, children start developing anxiety going to the doctor, right? And so with those, we sort of explain to the child and the parent how the procedure is going to take place. Often we'll do a little sample, let the child touch that prick so that they can see it's not a needle, it's not a shot, because isn't that what they're anxious about, right? Is getting shots at that time. So we'll go through that process and explain that to them. And a lot of times they're at ease then going into that procedure. So I would say almost all parents and children come out a lot thinking it's a lot, not nearly as bad as they thought it was going to be.
Well,
Yeah.
Good. And our shot room for the littles and even for the adults is pretty familiar and friendly place for the folks to come. Granted, you're getting a shot, but we do try to make it as painless and positive as we can.
That's right. And so what I typically tell parents is that after those first couple of weeks coming in for the allergy shots, the child is used to it. They're hardly making a fuss anymore at that point, and they're coming in, seeing those friendly, familiar nurses' faces who are the best part of our shot room. They're usually getting a sticker on the way out the door and often happy to see us next time around. And again, with adults, it's the needle is small, the injections are quick, and so I find that really after the first couple of visits in our shot room, most patients are more excited about talking again to those friendly, familiar faces than they are anxious about their allergy shots.
I think one of the things to remember is that it is something that is beneficial in the long term. It's like when you work out or you train for a marathon or whatever it might be, you're retraining your immune system.
That's
and
right.
so that takes some time and it will be beneficial, especially for those littles.
Yes, that's right. That's what I try to remind patients is this is a long-term solution. And the work that you put in is going to give you benefit while you're on those allergy shots and then years beyond when you quit those allergy shots. So while every patient's course is a little different in regards to how long they're going to be on the allergy shots, we do know that those that complete their program get 7 to 10 years of continued relief of their allergies and some even beyond without allergy shots anymore. So it's really, it's important to consider that as part of your treatment program if your allergist recommends that.
Yeah, an investment in your immune system.
That's right. Yep, in your health and your immune system.
There you go. All right. Well, thank you again, Dr. Rohman.
Yes, thank you for having me, Marcella.
All right. Thanks for listening. And that does it for this episode of Let's Clear the Air.
We hope you've enjoyed this episode of Let's Clear the Air. Please consider following this podcast, and remember, if you want helpful and accurate information about allergies and asthma, our allergy experts are here to clear the air.